because they have to keep making new pins, because when you cover them, it wrecks the pins. Okay, take a look at this inner thigh. What you see when you start is one muscle up here, one big flat muscle, and that's called the sartorius, okay? And one big muscle like this, and that's called the gracilis. So let me show you the sartorius, okay?
Please do.
The sartorius starts on the ilium, goes all the way around and comes down under the knee, okay? So when you move, it bends the hip and the knee because it starts way up here on the hip and comes around like an S. So you're not going to have any trouble remembering sartorius, S-shaped muscle, right? It is the largest muscle in the human body. So this is the one on the cat. It's very, very flat, but it's starting way up here at the hip, way, way up, and coming down here below the knee. So it crosses over from lateral to medial like an S shape, okay? The gracilis is an adductor of the inner thigh. So it goes, it's a very thin, flat one that goes across the inner thigh. What we do to study all the rest of the inner thigh muscles and the hamstrings is we take the gracilis back. We do what's called reflected. So when the muscle is reflected, you got to kind of be like, oh, I see this flap over here, like that epitrochlearis, and you know that that muscle was supposed to be down, but now it's flipped back, okay?
Yeah.
Right. But if you don't know that, that gets you really confused, right? Because then you're looking for something that's not here anymore. These two, together with that biceps femoris, are your hamstrings. These guys right here, okay? They're not really attaching to the femur until they hit the joint right down here almost. And that's what the hamstrings do. They're coming and inserting way down near the tibia, all right? So these two are hamstrings. These are inner thigh muscles, two different groups. Inner thigh muscles come, see where the artery and the nerve and all that is? That's where the bone lies. So they come in to that, do you guys remember the linea aspera of the femur? Okay, that's where they come and insert. And their job is basically to take a leg that's out at the side, okay, and bring it in. They're like horseback riding muscles, or if you're going to do squats and squeeze, they're the ones that help you bring the legs together, okay? So if you were to like take those little, muscle builders and put between your legs and squeeze in on it, those are the muscles, adductors. You have a tiny one called the pectineus. That's in pink, P pink, pectineus. Then you have a red one. This muscle here had bruising. So you can see the dark coloration right here, and there was some blood loose in here. And when muscles bruise, they don't dissect well, they shred. So this is actually one long, thin muscle, and I urge you to look at this on other cats, okay, because it'll be better in other cats. But there's a really teeny little triangle-shaped one called the pectineus, way up in the groin. It's just doing a really small thing from the pubis to the femur, okay? Then there's a long one, adductor longus, long and thin. Then there's one that looks like a wedge of cheese, see? Wide, narrow, okay? So it's yellow, like cheese, okay? Adductor femoris, those are your adductors. This one that looks like a ribbon is the semimembranosus, okay? It adducts and it's a hamstring, bends the knee, okay? This one is the semitendinosus. Do you see the tendon that it keeps connecting with? It got its name in the human because of that really long tendon. And it's one of the two on the back side of the leg. Semitendinosus, biceps femoris, those two that I showed you, okay? So, ready? The gracilis was here. Now it's there. Inner thigh muscle, gracilis. Upper thigh muscle, not inner thigh muscle, sartorius. Inner thigh from groin going all the way down to the hamstrings. Pectineus, adductor longus, adductor femoris, semimembranosus, semitendinosus, okay? And those are on the board right there under the clock to help you guys learn them. They're already pinned. There's a whole bunch of cats that are already done. So